Hello, I'm Dr. Noelle Gillette Cloven. I'm a gynecologic oncologist with Texas Oncology Fort Worth, and I'm here in Chicago at ASCO 2025 with Dr. Angela Alvarez Secord, and we're here to discuss her poster presentation, which is a trial of rinatabart sesatecan versus investigator's choice chemotherapy, GOG-3107. Dr. Secord, would you mind telling us a little bit about the mechanism of action of the drug?
Oh, absolutely. Happy to go through all of that. And also so excited to be here. Thank you for inviting me. We're thrilled to be talking about GOG-3107, also known as the RAINFOL-OV2 study. So rinatabart sesatecan, I will call it Rina-S from here forward, is a really exciting novel antibody drug conjugate. And the mechanism of action is similar to other antibody drug conjugates in that there's a monoclonal antibody targeting, in this case, folate receptor alpha. And then upon entry into the cell through a hydrophilic protease linker, releases a payload, which is a topoisomerase 1 inhibitor called exatecan.
So, and there has already been a phase 2 trial where results have been presented at another meeting. Can you discuss that briefly?
Yeah, super exciting trial. So first of all, I just want to say we already know FR alpha is a very good target, and that's been shown in multiple studies and actually with other drugs as well. And what's a little different here, and we're going to go through that a little bit further, is the study that you mentioned. The objective response rate was really awesome, 55%, including 4 complete responses.
That's incredible in a platinum-resistant population. So you were talking about that amazing response. So was that only in patients with folate alpha overexpression?
No, thank you so much for that question. It's really awesome because the response was seen in patients regardless of FR alpha expression.
Wow, that's awesome. So, so no folate receptor overexpression required for the trial, platinum-resistant ovarian cancer. Can you tell us more about the eligibility for the trial, for the phase 3 trial?
Absolutely. So additional eligibility criteria includes the histologic subtype, so specifically high-grade serous and high-grade endometrioid ovarian cancer. But if you have any questions, just reach out and call us. We're happy to help with that. And then patients may have up to 4 priors. There are some specific eligibility criteria. For instance, if someone has a tumor that has greater than or equal to 75% expression of FR alpha, they are required to receive mirvetuximab first. And then if they have a BRCA1 or 2 mutation, treatment with a PARP inhibitor. And for select patients, bevacizumab would be required as well. I do want to point out, in terms of the prior treatment with mirvetuximab, even though this drug, Rina-S, targets FR alpha, and a really important element here is that the payload is different. So if you have a patient who progressed on mirvetuximab, if we're able to still target FR alpha, but with a different payload, in this case topoisomerase inhibitor, they may still have benefit.
That makes sense. So what about the side effects of the treatment? Is there anything unique about this drug with the different payload that we need to look out for?
Very similar to other drugs with this type of payload, you're going to have hematologic toxicity, but you can mitigate that by the use of growth factor support, and you really need to have a great understanding of who is at greatest risk. But what's wonderful in terms of the protocol, it's all spelled out in terms of how to treat these patients to mitigate those side effects. A really exciting aspect with this drug is that there does not appear to be as high of a frequency of interstitial lung disease or the ocular toxicity. And the other exciting thing so far is there does not appear to be a high degree of neurotoxicity, which is really important when you're talking about patients who have platinum-resistant ovarian cancer and who've been heavily pretreated. That's
excellent. And I think there can be some alopecia, but not as much as with some of the other drugs. So that's also good news for our patients. Just thinking about this phase 3 trial, we're very excited. It just recently opened. Do you have any tips for how to best screen patients in our practices for the trial? What is really awesome about this study is that patients can go on regardless of FR alpha expression. So that decreases some of the issues in terms of screening patients for the trial. I would strongly recommend screening all your patients who are potentially eligible. The eligibility criteria, the exclusion criteria are pretty easy to understand. So my feeling is that right now with standard therapy, we're just not hitting the mark in terms of the levels of activity we need to see. And that's the case whether it's weekly paclitaxel, liposomal doxorubicin, gemcitabine, or topotecan. The response rate of over 50% with this antibody drug conjugate in platinum-resistant ovarian cancer or heavily pretreated patients is really, really exciting. So I'm offering it to all my patients who are eligible. I agree. I think it's best anyone you have on any sort of treatment for platinum-resistant ovarian cancer, go ahead and screen and see if they're eligible for this trial as their next option.
Yeah.
So thank you for going over that with us. That's excellent, and it's always good to have a new drug on the horizon for our patients. We need more breakthroughs, and this looks to be one of them. Thank you.
Yeah, absolutely. Thank you so much, Noelle.